Welcome yet again to the first Hannibal LaGrange University High School Nursing Competition. This is your Quiz Bowl portion of the day. My name is Catherine Martin, and I will be your host. Our Quiz Bowl is set up Jeopardy style. Who of you have watched Jeopardy before? Most of you, awesome. Please listen closely to the rules of the game. You will soon see a board. When you're on stage, the board will be in front of you. Right now, the board is behind you. The board has 6 categories and 5 clues in each category, each worth a different amount of dollars, and each dollar is equivalent to 1 point. The higher the value, the more difficult the question will be. Clues will be read by me, your host, and regardless of who picks the clue, any team can buzz in to answer. You will use the iPad on your table to buzz in. The first team to buzz in gets a go at the question. There's no deduction of points for incorrect answers. There will be approximately 10 seconds per clue before moving on. And if one team gives an incorrect answer, I will give the other team approximately 5 answers to give a correct answer before sharing the right answer and moving on to the next. As with Jeopardy, your response needs to be phrased in the form of a question. Here is an example. We'll see if any of you know the answer. Example clue: a wonderful liberal arts university located in America's hometown. Ding, 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 ding! That's the correct answer! Amazing! The team who gets the correct answer will next pick the clue. You can pick any clue on the board. However, sticking to one category and going from lowest to highest is preferred. Each round of trivia is limited to 15 minutes. Before we start the first round, Brennan, one of our grad assistants at Hannibal LaGrange University, will help the first teams find their places on the stage. You'll be entering the stage to my right, your left, and leaving from the other direction. Brennan, you may call the first teams.
Our first teams competing are number 6, MacTech, and number 9 from MacTech. Number 9, you guys will be right over here.
Number 6, right here. Number 9, right here.
Who do you want as like a spokesperson?
My table 2 buzzer is number 6, MacTech. That's correct. And my table 3 buzzer is number 9, MacTech. Correct? Perfect. Go ahead and bring up the Jeopardy board for me. Here are our categories, and they will be the same categories for each round of trivia that will be played today. We have problems and illness, ethical and legal, communication, the human body, the whole person, hazards, risk, and safety. Please check your iPads for your buzzards. Make sure you have a blue buzz. That means it's active and ready to go. Perfect. Are y'all feeling ready? Y'all feeling nervous? Ah, there we go. We're ready. I want to see some excitement from my audience. Yes. Yes. I will begin by selecting the first clue. Problems and illness for 200. Passage of liquid, unformed feces. Okay, looks like number 9, Mac Tech, has an answer to share. You should be on. Just speak into your microphone.
What is diarrhea?
That is correct. Number 9, Mac Tech, has 200 points. Would you mind, spokesperson, would you mind holding your mic the whole time? Can you do that for me?
Yeah.
Thank you very much. That would be amazing. And since you got that correct, you will now select the next clue, and I have to reset the buzzers. It's a learning curve for all of us. Here we go.
So just choose anyone.
Just choose one.
The human body for 400.
The human body for 400. Plasma, blood, saliva, urine, and interstitial fluid. Number 9, MacTech, what is your answer?
What is bodily fluids?
We will accept that answer. What are body fluids?
Yeah.
Number 9, MacTech, 400. Perfect. Please select the next clue.
Let's go the human body 200.
The human body, 200. The structures of the pulmonary system which carry oxygen-rich air to the lungs. Number 6, MacTech.
What are alveoli?
That is incorrect. Number 9, MacTech, do you have an answer?
What is the airways? I have no.
That is correct. Number 9, MacTech for 200. Number 9, MacTech, please select the next clue.
Ethical and legal for 400.
Ethical and legal, 400. Making a false spoken statement damaging to a person's reputation. Number 6, MacTech.
What is slander?
That is correct. Number 6, MacTech for 400. Number 6, MacTech, please select a clue.
We'll do the whole person 200.
The whole person, 200. To cause or allow to flow over the edge of its container. Example, a liquid, especially accidentally. Number 6, MacTech.
What are spills?
That's correct. Number 6, MacTech, 200. I'd like to thank our audience. You guys are doing a phenomenal job with the energy in the room. Thank you. Good job. I like it. That's fantastic. Okay, number 6, MacTech, please select our next clue.
Okay, 200? Okay. Communication 200.
Communication 200. The process of communicating nonverbally through movements and gestures. Number 9, MacTech, what is your answer?
What is body language?
That is correct. Number 9, MacTech for 200 points. Please select our next clue.
Let's go the human body 600.
The human body 600. Hangs or swings loosely. Example, one's legs. Number 6, MacTech.
What is dangles?
I will accept that answer. What is dangling? Very good. Number 6, MacTech for 600. Number 6, or team 6, please select the next clue.
Whole person for 400, please.
The whole person for 400. A substance to make something clean or hygienic. Number 9, MacTech.
What is a disinfectant?
I will accept that answer. Number 9, MacTech for 400. Hold up just a second. Okay, number 9, MacTech. Please select your next clue.
Communication for 400.
Communication for 400. Restlessness, tension, apprehension, distress, and worry. Number 9, MacTech.
What is anxiety?
That is correct. So that was number 9, MacTech for another 400. Please select the next clue.
Problems and illness for 400.
Problems and illness for 400. Intermittent or persistent pain for a long time. Number 9, MacTech buzzed in.
What is chronic?
Correct. Number 9, again for 400. Give me a second. Let me reset my buzzers again. Number 9, MacTech, please select a clue.
What is ethical and legal for 200?
That's funny. Treatment in a polite and friendly way.
No.
Okay, number 6, MacTech.
What is courtesy?
Not correct. Number 9, do you have an answer?
What is etiquette? I have no clue.
No, the answer is what is respectful treatment? Thank you. Okay, team number 9, will you please select our next clue?
What is ethical and legal? 600.
Ethical and legal for 600. The state or fact of being accountable for something. Number 6, MacTech.
What is responsible?
Correct. So that was team number 6 for 600. Please select our next clue.
Can we do hazards, risks, and safeties for 200?
Yes.
I know it's so bright.
A cleansing procedure performed by or for patients for hygienic or therapeutic purposes. Time is up, and the answer is, what is bathing?
Okay.
Okay. Team number 6, please select our next clue.
Okay. We'll do hazards, risks, and safety again for 400.
Okay. Vitamins, minerals, and compounds added to one's diet to benefit health. Okay. Number 6, MacTech.
What are nutrients?
Not an acceptable answer. Number 9, MacTech, do you have an answer?
What are electrolytes?
No. What are nutritional supplements? Okay, number 6, MacTech, will you please select the next clue?
Can we do problems and illnesses for 600?
Problems and illnesses for 600. An inability to digest milk and some dairy products. Number 9, MacTech.
What is lactose intolerant?
Correct.
Very good.
Number 9, MacTech. That was 600 points. Great job. Great job.
Communication for 600.
Wearable instrument for the purpose of aiding impaired human hearing. And that was buzzed in first by number 9, MacTech.
What is a hearing aid?
Correct. Number 9, MacTech for 600. Please select our next clue.
What is the whole person for 600?
So, what did you say again?
What is the whole person? The whole person for 600.
The whole person for 600. A factor that causes a person to be susceptible to an unwanted, unpleasant, or unhealthful event. Number 9, MacTech.
What is a risk?
We will accept that answer. What is risk factor? That was number 9, MacTech for 600.
Hazards and risk for 600.
Hazards and risk and safety for 600. A gathering of people for the purpose of worshiping God.
We'll try it.
Let's see, number 9, MacTech did buzz in first.
What is a congregation?
We will accept that answer. What is a religious service? So that was number 9, MacTech for 600.
The human body for 800.
The human body for 800, pertaining to the radius. Buzzed in first by number 6, MacTech.
What is radial?
That is correct. Number 6, MacTech for 800. How much time do we have left? Okay, we're doing good. Okay. Number 6, MacTech, please select our next clue.
The whole person for 800.
The whole person for 800. Maintenance of a person's essential physical functions when very ill. Number 9, MacTech.
What is physical therapy? No clue.
That is incorrect. Number 6, MacTech, do you have an answer?
What is life support?
That's correct. Great job.
Good job, Adam.
That was number 6, MacTech for 800 points. Number 6, MacTech, please select the next clue.
Ethical and legal for 800.
Dishonesty or deception intended to result in financial or personal gain. Number 6, MacTech, you have buzzed in first.
What is financial abuse?
That is incorrect. Number 9, MacTech, do you have an answer?
What is manipulation?
Incorrect. The answer is, what is fraud? Okay. Number 6, MacTech, please select our next clue.
Problems and illnesses for 800.
Inflammation, sore, or ulcer in the skin over bony prominence. Number 9, MacTech.
What is a bed ulcer? I don't know what. I don't know the actual.
The judge has spoken. We will accept that answer. What is pressure ulcer? Number 9, MacTech for 800.
I can. The human body for 1,000.
The human body for 1,000. The skin, its appendages, hair, nails, sweat, and sebaceous glands. Number 6, MacTech.
What is the integumentary system?
Good job. How do I say that word? Thank you. Perfect. I love it. That was number 6, MacTech for 1,000. And this is our last question. Number 6, MacTech, please select our final clue for this round.
The whole person for 1,000, please.
The whole person for 1,000. The minimum infection prevention practices that apply to all patients. Number 9, MacTech, buzzed in first.
What are standard precautions?
That is correct. Number 9, MacTech for 1,000. Excellent job, everybody. You may exit the stage to your left, and Brennan will call up the next teams.
The next teams to compete are number 8 from MacTech and number 12 from MacTech.
We believe that accessing care close to home is better for you and better for your family. For 120 years, Hannibal Regional has been committed to providing community-based, contemporary health care, from state-of-the-art surgical care to innovative cancer care, and now life-saving open-heart surgery. We are dedicated to expanding access to exceptional care in each of the communities we serve. Hannibal Regional, why go anywhere else?
You must frame it as a question. What is? What? It's just you talking. I'm telling you that.
Are you ready?
Yeah.
Are you nervous?
No.
Good. You ready?
My palms
And you're
are sweaty.
nervous?
My knees are weak. My arms
You're
are weak.
honest. Here we go. We got this. You're going to be great. I love it. Go ahead and bring up our board for us, Randy. Same clues, same categories as last time. We have problems and illness, ethical and legal, communication, the human body, the whole person, hazards, risk, and safety. Everyone have a blue buzzer in front of you, and everyone's iPad shows you're connected. At any point it says disconnected, let me know. I will reconnect your iPads for you. And do any of you feel you need me to repeat the rules?
No, I believe we're good.
Good? Okay. Then let's start our trivia. I will begin with problems and illness for 200. Accumulation of hardened fecal material in the rectum. Number 8, MacTech buzzed in first. What is your answer?
What is a hemorrhoid?
That is incorrect. Number 12, MacTech, do you have an answer?
What is stool?
We will not accept that answer. The correct answer is what is fecal impaction? Okay. I will select the next answer, or the next clue. Ethical and legal for 200. Lack of respect or courtesy, insult. Number 8, MacTech, you have buzzed in first. What is your answer?
What is rude?
That will not be an accepted answer. Number 12, MacTech,
What is disrespectful?
that is a correct answer. What is disrespect? Number 12, MacTech, for 200. Number 12, MacTech, please select the next clue.
The human body 200.
Human body for 200. The process of taking air into and expelling it from the lungs. Number 8, MacTech, you have buzzed in first.
What is inhalation?
We're still thinking. Incorrect. Number 12, MacTech, do you have an answer?
What is respirations?
We will accept that answer. Also more simply known as what is breathing. Number 12, MacTech, please select our next clue.
Human body, 400.
Human body for 400, the act or process of vomiting. Number 8, MacTech.
What is regurgitation?
Incorrect. Number 12, MacTech, do you have an answer?
What is puking?
Incorrect. What is emesis? Okay. I believe it's number 12, MacTech. Will you select the next clue?
Communication, 200.
Communication 200. Ongoing, dynamic series of events that involve the transmission of a message from sender to receiver. Number 8, MacTech.
That's not right. What is chain of command?
That is not correct. Number 12, MacTech, do you have an answer?
What is communication?
That is correct. Good job. Great answer. That was number 12, MacTech for 200. Please select the next clue.
400, communication.
Communication for 400. A serious disagreement or argument.
What is a conflict? I'm sorry.
Number 8, MacTech, that is the correct answer. Thank you very much.
We got one.
Number 8, MacTech for 400. Number 8, MacTech, will you please select the next clue?
Can I get the whole person for 600?
The whole person for 600. A simple transfer device used to aid in the safe movement of a patient. Number 8, MacTech, what is your answer?
What is a gate belt?
That is an acceptable answer. What is also known as what is a transfer belt? Number 8, MacTech, got that answer for 600 points. Please select your next clue.
What is the whole person for 400, please?
Whole person for 400, a substance to make something clean or hygienic. Number 8, MacTech, what is your answer?
What is a disinfectant?
That is correct.
This is my mojo.
Okay. Number 8, MacTech, please select the next clue.
Can I get the whole person for 800?
The whole person for 800. Temperature, pulse, respirations, and blood pressure. Number 12, MacTech, you have buzzed in first.
What is vital signs?
That is correct. Number 12, MacTech for 800.
I know.
Number 12, MacTech, please select our next clue.
Human body, 600.
The human body for 600, the way a person moves as they go about their daily life when sitting, standing, lifting, carrying, and bending. Number 8, MacTech, what's your answer?
What are the activities of daily living?
We will accept that answer. So that was number 8, MacTech for 600. Okay, number 8, MacTech, please select our next clue.
Can I get hazards, risks, and safety for 400, please?
Yes. The activities of washing, cutting, or arranging the hair. Number 12, MacTech, what is your answer?
What is bathing?
That is incorrect. Number 8, Mac Tech, do you have an answer?
What is self-care?
Incorrect. The answer is, what is hair care?
Yeah, duh. What are we doing here?
Okay, number 8, Mac Tech, would you please select our next clue?
Can I get the whole person for 1,000, please?
Whole person for 1,000. Here we go. Which I don't think I've even reset the buzzers. Changing a patient's position in bed every 2 hours.
Don't press that thing. Yeah, press that thing.
Number 8, Mac Tech.
What is repositioning?
Correct. Number 8, Mac Tech for 1,000. Please select our next clue. 5 more minutes for this round.
Can I get the human body for 800, please?
The human body for 800. Relating to or denoting an apex.
What is apical? Oh, I'm so sorry. My bad.
You're fine. Number 8, Mac Tech, please state your answer.
What is apical?
That is correct. So that was number 8, Mac Tech for 800. Number 8, Mac Tech, please select our next clue.
Can I get the human body for 1,000?
Neurons, neural pathways, and parts of the brain involved in sensory perception. Number 12, Mac Tech.
What is central nervous system?
Not correct. Number 8, Mac Tech, do you have an answer?
What is the sensory nervous system?
Is that your final answer?
Yeah.
That is correct. Number 8, Mac Tech for 1,000. Number 8, Mac Tech, please select your next clue.
Can I get problems and illness for 600?
Problems and illness for 600. A disorder characterized by abnormal loss of bone density. Number 12, Mac Tech.
Oh, I just forgot. What is it? Hold on. Be fast. Hurry.
Time is up. I am bouncing over to number 8, Mac Tech. What is your answer?
What is osteoporosis?
Correct. Number 8, Mac Tech for 600. Okay. Number 8, Mac Tech, please select our next clue.
Can I get problems and illness for 400?
Abnormal accumulation of fluid in interstitial spaces of tissues. Number 8, Mac Tech.
What is edema?
Correct. Number 8, Mac Tech for 400. That's not what my phone says. Okay, number 8, Mac Tech.
Can I get problems and illness for 800, please?
Problems and illness for 800. A hyperexcitation of neurons in the brain leading to sudden, violent, involuntary contractions of the muscles. Number 12, Mac Tech, what is your answer?
What is seizures?
That is correct. Number 12, Mac Tech for 800. Last question, number 12, Mac Tech, please select our final clue for this round.
Promise and illnesses, 1,000.
Problems and illness for 1,000. A group of diseases resulting in too much sugar in the blood, high blood glucose. Table 2, which is number 8, Mac Tech. What's your answer?
What is diabetes?
Correct. Number 8, Mac Tech for 1,000. Great job.
The academic comeback is insane.
The next teams to compete are number 7 from Mac Tech and number 10 from MacTech.
One seat.
Testing. Okay, like, yeah.
Welcome to the stage for your portion of Quiz Bowl. Are we excited?
No.
So it'll be over. You'll be fine. You're going to do great. I can feel it. I hope so. Same categories, same rules. Anyone need me to go over the rules again? Wonderful. Then let's get to our trivia. Just like before, I'm going to start by picking the first one. Before I do that, I want to make sure I have the right teams. Here at table 2, I should have number 7 MacTech. That's correct. And here at my table 3, I should have number 10 MacTech. Very good. And you have blue dots on your screen, so you should be able to buzz in. Anytime you get disconnected, let me know. I'm a human. I make mistakes often. I will try to make as few as possible. Let's have some fun. I have a little audience, so be loud. You got it? Let's have fun. Let's get started, Mr. Randy. Problems and illness for 200. Condition characterized by difficulty in passing stool or infrequent passage of hard stool. Looks like number 7 MacTech was the first to buzz in. And what is your answer?
What is constipation?
That is correct. Are you okay over there?
No, yeah.
Okay. So that was number 7 MacTech for 200, and you will now select our next clue.
I'll take the whole person for 200.
Whole person for 200. An undesirable event that occurs unintentionally and usually results in harm, injury, damage, or loss.
Can I go ahead?
Yeah.
What is an accident?
Did you buzz?
Yeah, I buzzed.
Okay. Yeah, table 2. You did good. Sorry. Number 7, MacTech.
Okay.
You said what?
What is an accident?
Excellent. Very good. Correct answer. That is number 7, MacTech for 200.
This is scary.
Okay.
I'll take the whole person for 400.
Whole person for 400. Personal protective equipment, PPE, that provide a barrier germs for your hands. Number 7, MacTech.
What is gloves?
That is correct. Good job. Do you feel like you're buzzing and it's not working?
Yeah.
What?
Yeah. The whole person for 600.
Hold on. We're going to pause. You're fine.
What's happening? I buzzed every time and it's not listening.
Try something. You're welcome.
That's going to be really loud.
Hold up. Give me a minute. Your table 2, your table 1. And you are picking my next clue. Please say it again for me.
The whole person for 600.
The whole person for 600. Measurement of fluids that enter the body and leave the body. I still have that this is number 7, MacTech. This is table 2, buzzed in first. Please give me your answer.
Intake and output.
We will accept that answer. What is I and O?
The whole person for 800.
Hold on. No, you can't. Did you already bring it up? Will you skip this question? Just go on to the answer. We'll let you pick the next clue.
Okay.
Okay? I got disconnected.
The whole person for 1,000.
Okay. Inspection of the largest organ of the body.
What is skin inspection?
Did you buzz?
Oh, it didn't buzz?
Did you buzz in?
Oh, I'm sorry.
Okay. Can you buzz in?
Sorry.
Okay. Number 7, MacTech. What is your answer?
What is skin check?
We will accept that answer. Very good. So that's number 7, MacTech for 1,000. Did you try to buzz in for that one? Okay. Very good.
The human body for 200.
Human body for 200. Movement of blood through the vessels through the body by the pumping action of the heart. Number 7, MacTech.
Circulation. What is circulation?
That is correct. Number 7, MacTech for 200. Please select our next clue.
The human body for 400.
The human body for 400. Waste matter discharged from the bowels after food has been digested. Excrement. Number 7, MacTech. What's your answer?
What is feces?
That is correct. Number 7, MacTech for 400. Please select our next clue.
The human body for 600.
The human body for 600. Movement of a joint from maximum extension to maximum flexion as measured in degrees. Number 7, MacTech.
Range of motion. What is range of motion?
That is correct. Number 7, MacTech for 600. I promise this says you're slower.
The human body for 800.
What?
The human body for 800.
The human body for 800. To make or become wider, larger, or more open. You've already buzzed in, right? Yeah, they already had buzzed in. Number 7, MacTech.
What is dilation?
That's correct. Number 7, MacTech for 800. Please select your next clue.
The human body for 1,000.
The human body for 1,000. The brain and spinal cord. It's not What? Had you already buzzed in? Yeah. They did. Okay. Number 7, MacTech.
What is the central nervous system?
That's correct. Number 7, MacTech for 1,000. Please select the next clue. My buzzers are reset.
I'll take problems and illness for 400.
Problems and illness for 400. Condition characterized by chronic inability to sleep or remain asleep through the night. Number 7, MacTech.
What is insomnia?
That is correct. Number 7, MacTech for 400. My buzzers are reset. Will you please select your next clue?
I'll take problems and illness for 600.
Abnormal progressive condition of the lens of the eye, characterized by the loss of transparency. Number 7, MacTech.
What is ocular degeneration?
That is incorrect. Number 10, MacTech. Do you have an answer?
No.
Okay. The answer is, what are cataracts? Number 7, MacTech. Will you please select our next clue?
I'll take problems and illness for 800.
Okay. A result when a blood clot blocks blood flow to the heart. Number 10, MacTech, what is your answer?
What is a stroke?
Incorrect. Number 7, MacTech, do you have an answer?
What is an embolus?
A what?
Embolus?
Incorrect. What is a heart attack?
Oh.
Okay. Number 7, MacTech, will you please select our next clue?
I'll take problems and illness for 1,000.
Problems and illness for 1,000. A group of lung diseases that block airflow, making it difficult to breathe. Number 7, MacTech.
What is COPD?
I'll accept that answer. What is chronic obstructive pulmonary disease, or COPD? Correct. Number 7, MacTech for 1,000. Please select our next clue.
I'll take communication for 200.
Transfer of information from one person to another without words or spoken language. Number 7, MacTech, what is your answer?
What is nonverbal communication?
Correct. Number 7, MacTech for 200. Please select the next clue.
I will take communication for 400.
Okay. Unkind, disapproving, or untrue conversation about a person's private life. Number 10, MacTech.
That's not. Rumors. Wait, no. What is? That's not right. Confidentiality.
Incorrect. Number 7, MacTech, do you have an answer?
What is slander?
Incorrect. What is gossip?
Okay.
Okay, number 7, MacTech, will you please select our next clue?
I will take communication for 600.
Communication for 600. Any degree of hearing loss from mild to profound.
It's not going.
Maybe. Okay. Number 7, MacTech, what is your answer?
What is deafness?
You're not, wait, sorry. Number 10, MacTech, what is your answer?
What is hearing impairment?
That's correct. Number 10, MacTech for 600. Please select the next clue.
Hazards, risk, and safety 200.
Hazards, risk, and safety for 200. Practices conducive to maintaining health and preventing disease, cleanliness. Number 7, MacTech, what is your answer?
What is hygiene?
That's correct. Number 7, MacTech for 200. Okay. Please select our next clue. Whoops.
Okay.
No, both.
He'll get out. Give him a minute.
Okay.
He's going to move out. We'll just wait for him. Just click through it. Okay.
All right. I'll take hazards, risks, and safety for 400.
Activities usually performed in the course of a normal day in the patient's life. Example, eating, dressing, bathing. Number 7, MacTech.
What is activities of daily living?
That's correct. Number 7, MacTech for 400. And then we'll do one more clue. Please select our final clue for this round.
What is, I'll take hazards, risks, and safety for 600.
Okay. Family-centered care designed to help terminally ill people live comfortably during end-of-life stages. Number 10, MacTech, what is your answer?
It's not, no. What is a long-term facility?
That is incorrect. Number 7, MacTech, what's your answer?
What is hospice?
Correct. Number 7, MacTech for 600. Thank you very much. You guys did fantastic. Yes.
That accessing care close to home is better for you and better for your family. For 120 years, Hannibal Regional has been committed to providing community-based, contemporary health care. From state-of-the-art surgical care to innovative cancer care, and now life-saving open-heart surgery. We are dedicated to expanding access to exceptional care in each of the communities we serve. Hannibal Regional, why go anywhere else?
All right, the next set of competition will have number 7, MacTech, number 8, MacTech, and number 9 from MacTech.
I moved one back to one, Brennan. I put that, yeah. It's fine. I think she just double clicked and she would zoom in. Like when I clicked, it worked fine every single time I tested it. I have 7, 8, not what that's nice. Two A.
I love SpongeBob.
No, I didn't.
Well, this is round 2 of our afternoon bracket. Congratulations. Much fun is being had on this stage. hopefully by more than just me. Same categories as before, but you will probably find that the questions are getting a little bit more difficult as we go on. So categories again are problems and illness, ethical and legal, communication, the human body, the whole person, hazards, risk, and safety. If you have difficulty with your buzzer, please let me know. You should all have a blue dot in front of you. Do only touch it once. If you touch it twice, it zooms and it doesn't come through to me. And I go by what I see on my screen as the table that's on there first. So if you do the it goes a little loopy, it doesn't come to me. Okay? That's how we're going to go with it. I'll get started with our first clue, and we'll go for 15 minutes like usual. So, first clue for this round is going to be problems and illness for 200. Difficulty in swallowing. We have number 7, Mac Tech.
What is dysphagia?
That is correct. Number 7, Mac Tech, 200 points. Excellent job. Please select our next clue. Hold up, I'm having difficulties. Do not select a clue. You should probably don't have buzzers yet because I need to refresh my page. Here we go. My room went away. Brendan, help me make a new room.
I might get into a fiber.
Okay. Number 7, Mac Tech, you got the first one, correct?
Yes.
Please, oh goodness. Please select the next clue.
We'll take the whole person for 200.
Whole person for 200. Hold up. That's not the same question I have on my screen. Okay. I probably clicked the wrong. I'm okay.
That's right.
I have to reload my screen. You said 2, what one? 2A? My board's not the same as yours. Okay, I'll use your board. Go for it. That's all right. Bring it up. Bring up the whole person for 200 again.
I remember the question. Can I answer it?
No. Okay, team number 7, MacTech, will you please bring up another clue?
Pick a new one.
Yeah,
All right. We'll take the human body for 1,000.
the human body for 1,000. Wait. Okay. Without fever, and I have number 8, MacTech. What is your answer? Okay, do I have any other teams? Okay, table number 7, MacTech, what's your answer?
What is normal body temperature?
Incorrect. Number 9, MacTech?
We have nothing.
Okay, what is the answer? What is afebrile?
Don't go for any more thousands.
Okay, number 7, MacTech, will you please select the next clue?
I'll take communication for 1,000.
Communication for 1,000. The action of working cooperatively with others to achieve a specific goal. Number 8, MacTech.
Why would we do this to ourselves? What is teamwork?
We will accept that answer. Number 8, MacTech for 1,000. Number 8, MacTech, will you please select the next clue?
Communications 800, please.
Communication for 800. The way you respect yourself through the way you represent yourself through telephone communication using manners. Number 8, MacTech. Time is up. I am moving on to number 9, MacTech.
What is telephone etiquette? Or how do you say that?
I will accept that answer. Number 9, MacTech for 800 points. Number 9, MacTech, will you please select the next clue?
Problems and illnesses for 800.
Gradual destruction of the alveoli, tiny air sacs. Number 7, MacTech.
What is emphysema?
That is the correct answer. Number 7, MacTech for 800 points. Number 7, MacTech, will you please select our next clue?
I will take the whole person for 1,000.
The whole person for 1,000. Diseases spread through coughing, sneezing, laughing, and close personal contact. Number 8, MacTech, was the first to buzz in.
What is droplet precaution? No.
Incorrect answer. Number 7, MacTech, would be next.
What is droplet?
Incorrect. Number 9, MacTech.
What is airborne disease or illness?
Airborne.
Yes, airborne. Yes, airborne.
Correct. Number 9, MacTech, for 1,000. Good job. Number 9, MacTech, would you please select our next clue?
What is ethical and legal for 1,000?
Ethical and legal for 1,000. Omnibus budget Reconciliation Act of 1990. Number 7, MacTech.
I bit off more than I
What
can chew.
is HIPAA?
Incorrect. Number 8, MacTech. Do you have an answer?
What is OBRA?
What is what?
OBRA. It's not it. It's
That is the correct answer.
no way. I'm not getting this anymore.
Number 8, MacTech
This isn't
for
real.
1,000 points. Will you please select our next clue?
Can I get ethical and legal for 600, please?
Ethical and legal for 600. A written statement of a person's wishes regarding a medical treatment. Number 7, MacTech.
What is signed consent?
Sign of consent. Incorrect. Number 8, MacTech.
What is a living will?
That's correct. Number 8, MacTech for 600 points. Please select the next clue.
Can I get ethical and legal for 800?
Ethical and legal for 800. An assessment of an individual's mental capacity to make voluntary, reasonable, and rational choices. Number 8, MacTech.
What is mental age?
Incorrect. Number 9, MacTech.
What is psychological assessment?
Incorrect. And number 7, MacTech.
What is cognitive ability test?
Incorrect. And the answer is, what is competency evaluation? I believe it's number 8, MacTech. Will you please select another clue for us?
Can I get ethical and legal for 400?
A person's desires regarding medical treatment when they are no longer able to express informed consent. Number 7, MacTech.
What is living will?
Correct. That's number 7, MacTech for 400 points. Team 7, will you select our next clue?
I'll take communication for 600.
A series of positions of authority within an organization that are ordered from lowest to highest. Number 8, MacTech.
What is chain of command?
That's correct. Number 8, MacTech for 600 points. Please select the clue.
Can I get hazard, risks, and safety for 600, please?
A subjective set of guiding principles and beliefs held that influence your decisions, actions, and choices in life. Number 9, MacTech.
What are beliefs?
Incorrect.
What's not belief?
Number 8, MacTech.
What are morals?
Incorrect. And number 7, MacTech.
What is ethics?
Incorrect. And the answer is, what are personal values? Number 8, MacTech, will you pick our next clue?
Hazard, risks, and safety for 800, please.
Maximizing an optimal level of functioning, regaining, or retaining independence. Will you please show us the answer? What is restorative care?
I should have known that.
Once again, Team 8, will you select our next clue?
Yeah, can I get the whole person for 600, please?
Personal Protective Equipment acronym. Number 9, MacTech.
What is PPE?
Correct. Number 9, MacTech for, I think that was 600, is that correct? Okay, perfect. Please select our next clue.
Problems and illnesses for 1,000.
Problems and illness for 1,000. A disease of the nervous system marked by tremor, muscular rigidity, and imprecise movement. Number 9, MacTech.
What is Parkinson's disease?
That's correct. Great job. Number 9, MacTech for 1,000. Okay, we're going to do one final question in this round. Number 9, MacTech, please select our last clue.
Hazards, risks, and safety for 1,000.
Hazards, risk, and safety for 1,000. Tasks that arise predictably and consistently at or above a certain period in the life of the individual. Number 8, MacTech. Time is up. Number 9, MacTech.
Well, I have no clue.
Time is up anyways.
Mindless.
And number 7, MacTech.
What are events?
And what is the answer? What are developmental tasks? Thank you so much, all of the teams. That was an excellent round despite all the technical issues. Actually worked kind of better. So I was just like, yes, no. second round of quarterfinals. So we're gonna have 10 minutes. This will be shortened to the earlier one. So instead of 15 minutes, we only have 10 minutes now. It's gonna go really fast. We're loading up these same categories as we've had all day. They're almost done populating on the screen. Problems and illness, ethical and legal, communication, the human body, the whole person, hazards, risk, and safety. Again, with the buzzards. If you buzz super fast, like double clicking, it doesn't always come through. So like just hit it once and let it come. And it works pretty well. If something happens, let me know. We'll work through this. I'm going to get started by selecting my favorite, which is problems and illness for 200. An illness of rapid onset and short duration, person is expected to recover. I see that MacTech, number 9 MacTech buzzed in first, and your answer is?
What is acute illness?
Correct. Number 9 MacTech for 200. That's what I like to hear in the quarterfinals. That's some nice energy in the room. Resetting the buzzards. Number 9 MacTech, please select our next clue.
Ethical and legal for 600.
Ethical and legal for 600. We're going to bounce today. Negligent by a healthcare professional. Looks like number 8 MacTech buzzed in fast.
What is neglect?
Incorrect. Number 9 MacTech, do you have an answer?
What is abuse?
Incorrect. The answer is, what is malpractice?
Yeah, that's right.
We go resetting these buzzards, and we're going to bounce back to number 9. MacTech, will you please select our next clue?
What is the human body for 600?
The human body for 600. The point at which 2 or more bones meet to allow movement. Number 8 MacTech.
What is a joint?
No, it's okay.
What is joint? Correct. So that would be number 8 MacTech for 600. Great job. I'm resetting these buzzers again, making sure we're nice and fair and even. Remember, just click it once. Wait a second. It'll buzz through. There we go. Number 8 MacTech, please select the next clue.
Can we get the human body for 8?
The human body for 800. The substance in red blood cells that carries oxygen and give the blood its red color. Number 8 MacTech.
What is myoglobin? That's not a real thing.
What are you saying?
That is not the correct answer, but number 9 MacTech. What is your answer?
What is hemoglobin?
That is correct. Number 9 MacTech for 800. Number 9 MacTech, what is the next clue?
The whole person for 600.
The whole person for 600. Making decisions based on evidence and clinical reasoning. Anyone gonna buzz in? Time is up. Oh. I'll allow it. Table 2. So I have number 8 MacTech. What's your answer?
Oh, it's already up.
It's already
Oh,
up there.
never mind. Never mind. No answer. Moving
We
on.
would not have gotten that one.
Moving on with that, resetting the buzzers. Thank you for your honesty. Who selected that clue?
It was.
Okay, number 9 MacTech, please select a clue for us.
The human body for 1,000.
Human body for 1,000. An automatic process. A person's body is steady on the inside and adjusting to changes and conditions on the outside. Number 8 MacTech.
What is homeostasis?
That is correct. Number 8 MacTech for 1,000.
Nice audible.
Great
Nice
job. Number 8 MacTech, please select the next clue.
Whole person. Can I get communication for 6?
Communication for 600. Non-judgmental, non-interpretive documentation. Number 8 MacTech.
What is true communication or factual?
I will accept that. What is factual communication? Great answer. Number 8, Mac Tech for 600. We have 5 more minutes. I told you this round would go fast. Number 8, Mac Tech. Let me reset these buzzers. Please select your next clue.
The whole person for 8, please.
The whole person for 8. Actions taken to lower risk of injury, loss, and danger to persons. Number 8, Mac Tech.
Say it before we run out of time.
Oh,
I already did. Go.
What is safety measures?
That's correct. Number 8, Mac Tech for 800.
I was like, go.
I didn't. I was busy. All right.
Number 8, Mac Tech, please select the next clue.
Let's get the whole person for 1,000, please.
The whole person for 1,000. Implementing measures to reduce the chances of damage from a situation. Number 8, Mac Tech.
Say it.
What is safety precautions?
Incorrect. Number 9, Mac Tech. Do you have an answer?
What are precautions?
Incorrect. What is risk reduction? Okay, number 8, Mac Tech. Would you please select our next clue?
Can I get hazard, risk, and safety for 800?
Hazard, risk, and safety for 800. The set of attitudes, values, behaviors, and traits of a person. Number 8, Mac Tech.
What are morals?
Incorrect. Number 9.
What is personality?
That is correct. Number 9, Mac Tech for 800. Number 9, Mac Tech. Please select the next clue.
Ethical and legal for 800.
Ethical and legal for 800. Violent acts towards persons at work or while on duty. Number 8, Mac Tech.
What is workplace violence?
That's correct. Number 8, Mac Tech for 800.
It don't matter.
I'm a gamer.
Okay. Number 8, Mac Tech, please select the next clue.
Can I get ethical and legal for 1,000, please?
Ethical and legal for 1,000. Following laws, being ethical, having a good work ethic, and having the skills to do the work. Number 8, Mac Tech, what is your answer?
What is professionalism?
That's correct. Number 8, Mac Tech for 1,000.
Damn!
We have lost.
Going crazy!
We're cooked.
We're cooked.
Number 8, Mac Tech, next clue, please.
Can I get problems and illness for 800?
Yes, you may. Any lost, absent, or impaired physical or mental function. Number 8, Mac Tech.
What is disability?
Correct. Number 8, Mac Tech for 800. Number 8, Mac Tech. Next clue, please.
Can I get communication for 800?
Communication for 800. Meetings held to share information and ideas about a person's care. Number 9, Mac Tech.
What is a care plan?
That is correct. What are care conferences? Number 9, Mac Tech for 800.
Communication for 1,000.
Communication for 1,000. The action of working cooperatively with others to achieve a specific goal. I'm sorry, I think you wanted to do it. We're going to let number 9, Mac Tech, have a stab at this one.
What is teamwork? What is teamwork?
Incorrect. Number 8, Mac Tech, do you have an answer?
What is protective healthcare information?
That is correct.
I think that's it.
Number 8.
I
That's
think
correct.
that's it.
Number 8, Mac Tech for 1,000.
I'm just better, I think.
Okay, wait. We have to
Last question. Number 8, Mac Tech. Let me reset my buzzer and pick the final clue for the
We have like
semi
7,000.
quarterfinal.
Can I get the human body for 200?
Which one?
The human body for 200.
Human body for 200. A general term for a blood vessel that returns blood to the heart. Number 8, MacTech.
Say it.
What is an artery? No.
What are you talking about? We just
That was incorrect. Number 9, MacTech.
What is a vein?
That is correct. Number 9, MacTech for 200. Thank you very much.
Exceptional care in each of the communities we serve. Hannibal Regional, why go anywhere else?
position. Our communities and throughout the country desperately need young people to step up to make a difference and to be relevant at such a time as this. Our speaker today has role modeled what it means to make a difference in healthcare in this community. From working in the neurosurgical intensive care unit to the emergency department to being a director of outpatient nursing services, she is an expert who strongly believes we can work together to offer safe, quality patient care through serving our community. Would you please join me in welcoming the Vice President of Nursing at Hannibal Regional Health System, Carmen Kindheart.
Well, if you could yell like that for your schools, I could use a little bit more encouragement. I have never seen healthcare people quiet, so I wouldn't expect to see it here. Thank you for having me here today. As Dr. Woldma, thank you for the introduction. I have been at Hannibal Regional for 28 years. I started when I was 12. We'll just go with that. Actually, I graduated from Hannibal LaGrange. So back then it was Hannibal LaGrange College because that's how old I am. So we'll leave it at that again. This is a fantastic program, and I am so excited to continue to work with HLG with getting our awesome nurses out that we have been able to. So you all are in the CNA programs at your schools. That's fantastic. I am so excited to see so many people interested in healthcare. I hope that you continue to go down that path. Are many of you looking at continuing in healthcare? Yes, awesome. Aha! You want a job already? I would love that. Yes. And I think I have some legal people over here. You had all kinds of now he's sinking down. What is a vein? I thought it was awesome. You know what? In healthcare, you have to be able to laugh as well as cry and support each other as you're going. And I think it was awesome that you guys help support each other. Nursing is a rewarding profession. You guys are finding that already. Are some of you doing some clinical practicum with your CNA stuff? Yeah? Are any of you working as far as a CNA now? Awesome. So what we are working on at Hannibal Regional, we have a patient care tech program. And actually, I am working now to start hiring some more CNAs into our program. And especially you guys that are in school, of course you can't work 8 or 12-hour shifts. So we are looking at doing some 4-hour shifts, some weekend things. So that would give you some opportunity to be able to get into our program. We also have a volunteering program. I don't know if anyone has heard of our volunteering program, but we like to bring a lot of people into that. And the emergency room seems to be a pretty cool place to do that. You get to see a little bit of everything. So one of the things that I would like to say as far as nursing, I always asked in your areas, just like you are in high school, what do I want to be when I grow up? Okay? I'm sure you're still asking yourselves that. There's lots of opportunities and career paths out there. My dad owned Hardee's restaurant. I'm sure most of you know what Hardee's is. So I started working when I was 12 years old at Hardee's. I could not go behind the counter, so I was out front. I took care of the trash. I took care of filling coffee and waiting on people out in the front and cleaning tables. And that's when I started to figure out what taking care of people meant. Veterans came in for coffee every day. I was able to listen to the stories of how they were able to get out and care for people and work to support our country. I was asking lots of questions, listening to all of these people that came in and out of the store. I grew up in that service industry, and I started asking more questions. I then, in high school, decided to start working at a pharmacy so I could learn a little bit more about healthcare. I did not have any family members that were in healthcare. They were all in business. And as I was going through high school and talking about this, my mom decided to become an EMT. So she actually took some courses and ended up on the ambulance. And so those are the stories that I heard and kept getting excited. So what I decided to do is came and talked to HLG and found a fit for me. I lived about 30 miles from here, so I was able to get back and forth. I still worked, just like you guys are doing, going to school, working, and learning about people. What I found out as I've gone through my years in nursing is this is a gift. This isn't a job. It's not just something that everybody can do. And to see you all here today excited about nursing, about taking care of people, makes my heart very warm. I am Nurse Kind Heart. I know that's funny. No, yeah. We have a new heart program at the hospital, and yeah, they're all like, oh, I said, well, you could just name it the Kind Heart Clinic or something, but I have to give millions of dollars for that to happen, and I don't have that. And my husband is actually a state police officer in Illinois, so it's much better to be Nurse Kind Heart than Officer Kind Heart. People don't think that's as funny. So, but as you get out into the world and you start taking care of people and you learn what it means to make a difference in the lives of others, nobody can take that away from you. I remember before I graduated here from HLG and before my last year of school, I took an internship in the emergency room. What a whirlwind. I saw children that were hurt. I saw adults that were hurt. I was able to sit there, hold hands of people that unfortunately were in at the end of life. And I about want to cry talking about it now. It impacted my life like nothing I can ever say. There was a gentleman that came into the hospital, into the emergency room, and of course I'm 19, 20 years old, and he came in, he had fallen asleep in his car, had been smoking, his car caught on fire, and he was burned terribly. There was absolutely his driver's license had melted, the registration on the car had melted. We had no idea who this individual was. They brought him in, and I sat for hours with this gentleman because we couldn't call his family. We didn't know who he was. He had a tube down his throat. Anybody know what that's called? Intubation. See, you're still working on these questions. He had a tube down his throat, and he did start to wake up a little bit. I sat there for hours as that intern, as that student nurse, and I worked to try to figure out what this gentleman's name was. He was able to mouth some words. He couldn't speak out loud, but I watched his lips. I wrote down everything that he said as far as trying to spell his name. Finally figured out this gentleman's name. We were able to find his wife, and she was able to get there before he passed away. So, yes, it's just, again, it makes me want to cry. But I'll tell you, 2 years later, I was at Walmart, and guess who came up and saw me in the aisle? And it's making me shake thinking about it. Who saw me in the aisle was his wife. I heard my name from down the aisle, and she just ran up and started to squeeze on me. It took me a minute to figure out who this person was. She remembered what I did for him. And I did it because nobody ever wants to die alone. And we needed to figure out who this person was. So those are the things that I'm telling you that nobody can take away from you. And I just thank God that I was there to be able to spend the time to help that gentleman. I don't tell a lot of stories, but for nursing, it is stories. It's about how those people make you feel and how you make them feel. I was at work one day at the hospital, or on my way to work, and I was coming down the interstate, and it was icy. So a car lost control, flipped over, landed on its top right in front of me, ended up in the median right in front of me. I got off to the side of the road, I got out, I went up to the car, and there was a mom and a baby in the vehicle as it's upside down. It was freezing cold outside. The windows were burst out of the car when it flipped over, and I climbed in the back of the car and got that baby out and was able to I had extra blankets and such in my car because, you know, as healthcare people, we carry blankets and Band-Aids and everything. So I had all those things in my car, and about that time, someone else, the 911 had arrived. They were able to get the mama out, but that baby might have froze to death. So, but that's some of the things that we're able to do when you are given the gift and the training to do what you need to do. Now, it's very important that you have the training so you don't hurt someone in the meantime. Like the mama that was upside down in the car. She had the airbag that had hit her, couldn't just take her out. She might have a neck injury. You guys all know that kind of stuff. But this baby, thank goodness, was in the car seat, which this is part of nursing also. Education, making sure people understand what it means to be safe. So those are some of the stories that I have when I went back to the hospital that day, because I cleaned myself off, went on into work, because what do we do as healthcare people? You got to go to work. There's still sick people. So went on into work. I had a gal that was sitting there working at one of my desks. She's actually had been in education and had been one of the teachers at our children's center. She came in, saw I was all a little bit disheveled from being out in a car crawling on the ground. And she said, what's going on? What just happened to you? So I told her about the story, and she just started to cry. The next day, I came back into work, and the first thing she did was run up to me and say, I just signed up for nursing school. So those are the things that you can touch lives. I can't say that enough on making sure that you give people back. And when you give yourself to them, they will give you back 3 times as much. Nursing is it's like I said, it's not a job to me. I go to work, but it's not a job. It is a gift. It is a blessing for me to be able to go to work and take care of people. Just this week alone, we have been the busiest at the hospital that we've ever been. Like I said, I've been there 28 years, and I've never seen as many patients come in the door that we've had, whether it be in the emergency room, whether it be just direct admits, sick people. After COVID, these people are still very sick, and they're coming in, and it's just all kinds of disease processes. The ones that you're learning about, it's a little bit of everything. And the team that I saw save lives this week, very emotional person, that I saw save lives this week makes me have goosebumps, because these are the people I work with. These are the nurses and the physicians that I work with every day that we come in to take care of saving lives. Now, some we weren't able to save, but guess what? I was able to sit down with that person and hold their hand for the end of life so they didn't have to be alone. And guess what? I would want somebody to do the same for me. So as you're going through school and you're looking at all those options out there, nursing is a really cool thing to do. You can work anywhere. You know, you don't have to just stay in your hometown after you get done. You can travel. You can work long-term care. You can work hospital. You can work emergency room. You can work in a clinic. I took care of clinic nursing for 14 years. I'm sure many of you have gotten hurt and had to come to the doctor, or just as pediatricians, we were in there seeing lots of little kids. You can do so many things, and I've been fortunate that I've been able to do a lot of those things. As she said, I worked in neurosurgery ICU. I worked in emergency room. I worked in surgery for 12 years. I did clinical recruitment. I'm now the VP of nursing. Never thought I would ever do anything like that, and this just happened within the last few months. But as we started talking about what we want for nursing, the reason that I'm doing this job is because I want to continue that tradition for nursing and make everybody understand what professionals do. We save lives. We take care of each other as well. It's not just your patients. You take care of each other. Watching you guys up here has been a lot of fun because you are taking care of each other. And that's what you do. Teamwork is something that if you ever feel what it's like to be on a team, you can't beat it because they have your back, you have their back, and that's what we do. We trudge forward. And I am just excited to see so many of you involved in healthcare. And like I said, HLG is a wonderful place to go. I graduated from there and I'm still going. We are fortunate to have programs through the hospital and HLG. We work very closely together. We have loan forgiveness programs, so if you decide to go on to school, we can work with you, and if we can get you in as the CNA, we can get you in there now. You can, we have nice sign-on bonuses once you, like $25,000. Does that sound good? Yeah, look at everybody smile there. But being able to help pay for your school, the scholarships that they offer here, the financial aid that they offer, there's so many things to help you. So when you get out of school, you don't have all of that extra burden, and you can work. You can work 12 hours, you can work 8 hours. You can work 7 days on and 7 days off. You can have a work-life balance, which is a really cool thing too. There's not a lot of jobs out there that let you do that. So I appreciate what you're doing. This is a fun event for you. And if there's anybody that ever has any questions about nursing, I am about as laid back as you get. I'm kind of a silly person once in a while, so I like to have fun at work as well as do what I need to do. But I am at Hannibal Regional. All you got to do is say, I need to talk to Nurse Kindheart, and they will be able to find me. Does anybody have any questions or anything? Would you like to see who's going to win this competition? Yeah! All right. Well, thank you again for having me today, and I wish you the best in your future endeavors. And please really consider nursing, because I would love to have you come join my team. Thank you.
Hannibal Regional has been committed to providing community-based, contemporary health care. From state-of-the-art surgical care to innovative cancer care, and now life-saving open-heart surgery. We are dedicated to expanding access to exceptional care in each of the communities we serve. Hannibal Regional, why go anywhere else?
ready for the finals. I need Hannibal number 2. Logan Gosney, Jalen Chandler, Riley Wiebold, Jenna McVeigh. You're sitting. Have a seat. And I need team number 8 from Mac Tech.
Why do we?
Because it's different. You too.
Jason Kane, Lanaya White, and Maya Paget. Paget? Paget. Okay, perfect. As you have noticed, as the competition went on, the questions got harder. And that is still true. You have in front of you paper and pen. And so this round of the competition, you will have 3 questions. You will have 5 minutes per question. And this time, instead of memorizing, which is what you have done for the first rounds of competition, you will instead be using critical thinking skills.
What does that mean?
We gotta really think.
It's gonna be like state questions.
Many, many, many years ago, I had a math teacher, her name, Mrs. Kinder, told me that memorization is the lowest level of learning. This is not. And that's what you're going to be doing. So I will read your question. I will set a timer for 5 minutes. You will work quietly at your little table. When the timer is up, I will pick up your papers, take it to the judges for them to review, and then I will read the next question. And we will do that for 3 questions. They will review it. One more thing, you guys start over at neutral. So right now, equal playing field. These 3 questions determine the winner of the trophy and the scholarship. No pressure, none at all.
Do we each get a piece, or do we?
We use 1 piece of paper
Per question.
per question. So put a 1. Start with 1 piece of paper and write a 1 on it, okay?
Does it bleed?
Here's your question.
Listen.
Please write legibly. If we can't read your answer, we cannot give you points. A patient's care plan includes a long-handled device for dressing and bathing. During the bath, you provide a long-handled sponge. The patient says, "I do not feel like using that today. Will you wash my feet for me?" How should you respond?
she was. After Jalen slams it.
These are nice pieces of paper.
Right?
Card stock.
Where'd you get these?
That bougie place.
I was expecting big lots.
Maybe like big lots.
Maybe the Dollar Tree.
Don't you tie my shoe?
Hello? Still working. Down door. Wait. Oh, sorry. My smile's beautiful. Are they still writing?
I don't hear it.
Are you done?
Oh, that's a cool color.
I will read the next question.
Okay, wait, the next question. I'm going.
What are the most common reasons/conditions people develop edema in their body tissues? You have 5 minutes.
Don't write this down yet.
Did she say right away?
Let's just do plates. Edema. How you get edema?
Wait, did she say write a list?
Just put bullet points. Do like lack of movement. Should we do like renal function?
question of the day.
And your third and final question. How do you know a person is going into shock? 5 minutes.
Abnormal breathing and abnormal respirations are the same thing. They're the same thing. You guys are just scratch that out. Don't scratch it out. Yeah. A slouched formation. Oh, what? A slouched one. Wait. Be like. Oh. Think about whenever somebody has a stroke. What do you check? I don't know. Their eyes and their body movement. Like if they move equally, their body. Like you have somebody to squeeze. If it's not, if like this one's deleted or this one's. How do you? Is it like body position? Well, it's like. Low body tension? It's body position. Low body tension? Like. Guys. That's a good one. It's good. It's like if whenever you check first, this isn't a stroke. I know, but this is whenever they go to show. I think we need to put what Riley's. I think we need to put what Riley's trying to explain. It's grab their weakness. You ask them to grab your hands. To weakness. That's body function. Goes into shock. You could put weakness. But like muscle weakness. Muscle weakness. We're gonna call that fine. Delayed body function. Delayed body function. Oh, hi. Delayed body function. Delayed body function. Body movement. Oh. I think that's it. I think that's good. I'm just gonna turn it over. This zero scored. 2 minutes. Do you think we were tied? And that's why? No. Because she said. What I do think.
If you'd like to go ahead and return to your seat. I don't know. I kind of like sitting up here.
I don't like sitting up here.
You don't want to be up here like in the live or something.
Oh, okay. I'm scared. What if we lose?
You sit right.
What if we lose? Oh, that's awful.
If we lose, we're giving them shit and say good job.
Oh, yeah.
Go to your seat in 2 minutes, but if you'd like to go.
Oh, we can go now.
We have to go to our seats.
Yeah, so let's just.
Thank you. Good. Our judges will. Our judges will be calculating now for the next few moments. And I believe there'll be some prizes about to be handed out soon, but not the awards. Thank you all for such hard work.
Hello, everyone. My name is Brennan Nick. I am a master's student here, getting my master's degree in leadership. Pass this over to Sam, let him introduce himself.
I'm Sam, and I get my bachelor's in business.
As a thank you to all of you, we wanted to do a couple of giveaways just to thank you all for coming in and competing and showing up. We know this is really hard, stressful sometimes, so we have a gift basket, a few gift cards, and a stethoscope to give away. So, yeah, Sam will be drawing the first name if he shakes that up a little bit. This is for the nursing gift basket. This is from our nursing department. All right, so we have for the nursing basket, Emma Cunningham. If Emma Cunningham could come up here, we will give that to her. Congratulations, Emma. Yeah, give her a round of applause. Congratulations, Emma. For our next giveaway, we will give away one of our $50 YU gift certificates. This is YU uniforms. And the winner of this $50 gift certificate is Miranda Harsel. All right. Congratulations, Miranda. Here you go. Oh, Miranda, can we get a picture? Miranda, can we get a picture? Sorry. Just hold that up there. Congratulations, Miranda. For our second $50 gift certificate, that will go to Christina Herner. All right, Christina, here you go. Congratulations. For our last giveaway, we have a stethoscope, and that is going to go to Jalen Plum. Awesome. Believes. Congratulations, Jalen. We get a picture here. Thank you all very much. You're good. Yep. Thank you all so much again. So I have some good news for you all. It turns out we have more to give away. So that's a happy problem to have. So this will be our $25 gift certificate to YU, this very first one. Keaton Hatcher. Keaton Hatcher wins that. Congratulations, Keaton. There you go. Get you a picture real quick. And our last prize to give away is a $50 gift certificate to our very own campus gift store. This goes to Rhiannon Compton. Congratulations. Get you a picture real quick. Thank you all very much.
So it's good to see all of you again. Saw you at the start, see you at the end. And so I get to have the distinct pleasure of announcing our second and first place winners. For our second place winners, we have some certificates for them. That is the Mac Tech team number 8. Congratulations, Mac Tech team number 8. We'll invite you guys up to the stage. And that, of course, means as well, including scholarships here, our first place winner is Hannibal team number 2. For the second place winners, we have the $25 certificates to you for the uniform shops there. And for the first place winners, come on up, guys. You get to take some hardware back for the year. Now you'll have to, someone from y'all's school will have to defend next year. And then in addition, we have some $500 scholarships to Hannibal LaGrange, on top of any other scholarships you're eligible for here at HLG. So we've got those for you as well. You'll see your names on those as well. And congratulations to all of you. I think we're going to get some photos here. Dr. Walgamuth, why don't you get in beside them? And they have shiny things on them.
Where are we looking?
You're looking that way.
Okay.
And then let's bring back up our second place winners to get some pictures with them as well. Hannibal, come this way. Right there. We hope you had a great time, and thank you, and we hope to see you back here on campus as students this coming fall. God bless you.